We're living in a very stressful time, and it made me wonder, what about those folks with a hearing loss? Has it changed their lives during this time? And I'm here with audiologist Dr. Gnewikow to learn more. And Dr. Gnewikow, what have you seen with your patients during this time?
First of all, I will keep my social distance from the camera, but I will drop my mask. The last 3 months has been one of the most difficult times for almost everybody in the country. I don't think any of us have ever gone through anything like this. It's very stressful. It affects everything that we do, and it also affects people with hearing loss. It affects families because now everybody has to stay home, and it may be that you kind of get a little irritated with your spouse because now you're having to repeat things a lot more than you did before. Communications with the outside are difficult. It affects our jobs. The unemployment rate has spiraled, and people are losing their jobs. And you know, when people don't hear well, sometimes that affects how well they're able to maintain their occupation. So it certainly affects people in that situation. It affects the caregivers. It affects the physicians and the emergency medical teams, because a lot of those people have hearing loss. And when they're talking with people trying to make emergency decisions, seeing the number they're seeing now, and they have a hearing loss, it becomes a problem, particularly because everyone wears a mask now. And when you have a mask over your face and you have a hearing loss, then it keeps you from being able to use your lip reading skills that you once had. So it even affects them. It affects people who are in nursing homes, or parents or grandparents, because they're pretty isolated anyway. And a lot of those people have hearing loss, and they have a lot of anxiety just because of their age and their hearing loss and the COVID. And so now not being able to communicate with their family can present some significant problems. So there are things that you can do. If you are a patient that wears hearing aids, wear them regularly. If you have issues with telephone communication, there are things that can be made available for you. Cap-tail phones and things like that, where you can communicate with your loved ones on the outside. A lot of people are going to Zoom technology now, where you can have a conference with your family. A few weeks ago, we had a conference with both of my kids who live in Tennessee. Everybody was in a different city, but we Zoomed with them, and we all ate dinner together. If you have a hearing loss with Bluetooth technology, you can set your hearing aids up to pick up directly from your computer. So there's a lot of little things that we can do. I think it's important, though, that we have compassion and that we take a little bit more time and a little bit more patience with people that have hearing loss. It's hard to communicate when they can't see your face, and I'm not advocating to take your mask off, but there are times that pulling the mask down, keeping your social distance, will allow them to be able to see you better. Talk a little bit slower. All the things that we tell people routinely to do when hearing impairment is an issue, but now it's so much more of an issue because people are so much more emotionally tuned to all of the things that are going on. And sometimes when you don't hear well, it makes the emotions even skyrocket further. So we want to do everything we can and be as compassionate as we can with people, and realize that hearing loss is exacerbated pretty dramatically during these times. And I think if we can do some things like that, slow down our speech a little, pull our mask down occasionally, keeping your social distance, of course. We don't want to cause issues with that. Talk a little slower, try to use technology where maybe you can Zoom to your grandmother in the nursing facility and things like that. All of those things may help, and they may help to reduce the anxiety. So we have to deal with family, we have to deal with medical personnel, we have to deal with you and your employer and your occupation. But I think if we work together on this, we'll eventually get through this virus. And it really is such that keeping a social distance doesn't necessarily mean isolation.
And to learn more, give the folks a call. In Lynchburg, you can reach them at 434-528-4245. In Danville, they can be reached at 434-799-6288. You can also find out more online at digitalhearingforyou.com.